All right, welcome to The Explainer. Today we are diving into a topic that is, let's be honest, really misunderstood. Impulse control disorders. We're going to go way beyond just looking at the behaviors and really get to the heart of the why behind the what.
You know, it's a question that so many of us, whether you're a parent, a teacher, a caregiver, you've probably asked yourself this. You see a kid who's constantly pushing back, arguing, acting out, and you can't help but wonder, is this just a phase? You know, are they just being a kid, or is something else going on here?
And that's where we get to the heart of it. Impulse control disorders, or ICDs, they're not just about a kid being badly behaved. Not at all. These are actual, recognized psychiatric conditions. And the core issue? It's a real, persistent struggle with self-control. We're talking about a difficulty that's so significant it really starts to impact their daily life.
So, that's our mission for today. We're going to get super clear on what these disorders actually are. We'll dig into the science, and maybe most importantly, we're going to look at the real, effective ways to manage them. So, let's jump right in and start by comparing the condition.
Okay, so first things first, we've got to be able to tell these conditions apart. There are three main ones we're going to focus on. And yeah, they can overlap, but each one has its own unique signature of defiance, disregard, and distress.
I think the best way to picture this is on a kind of spectrum. So on one end, you've got the constant arguing and defiance of what's called Oppositional Defiant Disorder, or ODD. From there, things can escalate to something more severe, conduct disorder, which involves violating other people's rights. And then you have Intermittent Explosive Disorder, or IED, which is a bit different. It's all about these huge, uncontrolled outbursts that are followed by intense regret. So let's break each of these down, one by one.
All right, first up is Oppositional Defiant Disorder, ODD for short. Look, we all know a 2-year-old saying no is totally normal, right? But ODD is different. It's a relentless, persistent pattern of anger, of arguing, of being spiteful. It gets to the point where it seriously messes with their ability to have friends or even just get along at home. This isn't just testing boundaries, it's like living in a constant state of conflict.
And if you think that sounds tough, get this. A staggering 40% of kids with ODD also have ADHD. Just think about that for a second. It means they're fighting a battle on two fronts. They're struggling with defiance and anger, and their brain is having a hard time with focus and self-control. It's a huge challenge. Okay, next up is conduct disorder, or CD. And this is really a significant step up in terms of severity. We're not just talking about arguing anymore. With CD, you're seeing a consistent pattern of behavior that violates the basic rights of other people. This can mean getting into fights, maybe even using weapons, destroying things, and this is key, a real lack of empathy, a kind of callousness about the harm they're causing.
And this is a connection you really need to understand. It's not a guarantee, not at all. But very often, ODD can be a stepping stone. In fact, a child with ODD is 4 times more likely to eventually be diagnosed with conduct disorder. And that statistic right there just screams how important it is to catch this early and get the right support in place.
And finally, we have Intermittent Explosive Disorder, or IED. The signature of IED is this very specific, vicious cycle. The outbursts aren't planned, they're not premeditated. They're just sudden, explosive failures of impulse control. The reaction is, and this is the clinical term, grossly out of proportion to whatever set it off. But then, and this is the heartbreaking part, it's almost always followed by this crushing wave of shame and remorse. It's just a devastating cycle. Rage, then deep regret. Okay, so that's the what. We've defined the conditions, but now we need to get to the why. And this next part is so important because it gets to the very core of this. These behaviors are not just a choice. There is real, hard science behind what's happening.
And a huge part of that science starts with our genes. The research is pretty undeniable on this one. Somewhere between 40 and 60% of the risk for these kinds of aggressive and antisocial behaviors has a genetic basis. It's literally, in part, written into a person's DNA.
And it goes beyond just the genetic code. We're talking about actual physical differences in the brain. We can see it in scans. People with ICDs often have less gray matter and lower activity in the parts of the brain that are like the command center for self-control. Think of it like this. Their brain's braking system just isn't as effective at stopping those impulses.
But here's the thing. Genes and biology are never the whole story, right? Environment plays a huge part. We're talking about things like tough childhood experiences, a lot of conflict in the family, inconsistent parenting. All of these things can create the perfect storm for these disorders to take root and grow. It's that classic, complex dance between nature and nurture, between our biology and our life story. Okay, I know. After hearing about the challenges and the causes, it can all feel a bit heavy, maybe even hopeless. But I want you to stick with me, because this next part is the most important part of this whole explainer. There is hope. There are absolutely clear, effective pathways to help.
And we need to frame this the right way. We're not talking about a cure like you'd cure a cold. That's not really the goal. The goal is management. It's about building up resilience, learning new skills. It's about equipping the person and their family with the tools they need to have a much better, more stable, and happier life.
So how do we do that? Well, treatment really stands on two main pillars. On one side, you have psychological therapies. That's all about changing negative thought patterns and building practical coping skills. And on the other side, you have medication. And it's crucial to know the meds don't treat the disorder itself, but they can be a game changer for managing some of the really tough symptoms, like aggression or severe irritability. So let's dig into those therapies for a sec. It really is a team approach. You've got things like cognitive behavioral therapy, or CBT, which helps a person see the link between their thoughts and their actions. Then there's parent management training, which is huge because it gives parents the playbook for how to manage behaviors and create more positive interactions. And you also have things like DBT, which teaches really practical skills for managing big emotions and getting through tough moments without exploding. Now let's talk about the medication piece again, because this is so important to get right. There is no magic pill for OD or conduct disorder. It just doesn't exist. The whole goal of medication here is to treat the symptoms. So a doctor might prescribe an SSRI to help reduce aggression, or maybe a mood stabilizer to help with irritability. And of course, if ADHD is also in the picture, stimulants are often used to treat that.
So, what's the big takeaway here? If you remember one thing from our time together, let it be this. These are complex conditions. They are rooted in a combination of biology and environment. They are not, and I really want to stress this, they are not signs of a bad kid or a bad parent. They are not character flaws. They are medical conditions. And like any other medical condition, they require understanding, compassion, and skilled professional support.
And that leaves us with one final, and I think powerful question to think about. When we can shift our own perspective, when we stop just reacting to the what, the behavior we see on the surface, and start trying to understand the why, that whole complex story of biology and environment we just talked about, how does that change everything? How does it change how we respond, how we support, how we teach? Because that shift right there, from judgment to genuine understanding, that's where the hope is. That's where the healing begins. Thanks for joining me on The Explainer.